Morning, everyone. Are we all here? Surgeons, Christopher, Kristen, Jim. Operation Restore Hope is a New Zealand charity that goes to the Philippines every year to help those underprivileged children born with cleft lip and palate. They devote their time, leave their family behind, and pay for their own expenses in the Philippines. I'm Hector Gonzalez, very proud Filipino New Zealander based in Auckland. Do your t-shirt, please, Michael. I coordinate all the necessary behind-the-scenes work in preparation for the team arriving in Manila from all over the world. We're here for 6 days only. The local hospital just provides the infrastructure for the team. Everything that we need, it's transported.
I'm very sorry, Mama. I love you.
We're just checking all the details are correct, making sure that the right kids with the right name, weight to check if they're going to be qualified for the surgery.
My name is Tristan Deschalane. I first came to Manila on a surgical mission with ORH in 2001, and I've been coming back every year since then.
Hello. Hello, who's that? It's organised chaos. There's about 120 children to be seen. Some of them are old friends, some of them are new cases, and every one of them is just gorgeous. How old is Romeline?
1 year and 3 months.
Good, it's a good time to do it. We will probably get through between 90 and 100 kids this week, and there are about 110, 115 people out there.
For a typically poor child, their access to healthcare is zero. It's a dream come true for them. It's a simple surgery that could just transform a child's life. So there's a lot of anxiety and fear for the local mums and dads. Hopefully, most of them will go ahead for surgery, but there will be some tears for those who will have their surgery declined.
Okay, that's it. Thank you! Kasi di ba yung iba, kooperahan lang tapos iiwanan na. Sila hindi.
The actual selection of who gets surgery is going to be dependent on A, the anaesthetist passing them as being satisfactorily healthy to undergo the surgery that's proposed, and secondly, what can we do in terms of prioritising? I would rather do a cleft repair on a 3-year-old than on a 3-month-old, because I can always come back next year and do some work on the 3-month-old. But the idea is we will try and do the right thing for as many patients as we can. Ella, can I have a look? Before the patient leaves today, they will know whether they have been selected, and they will know what day and where they have to be when. Okay, so we need to see the anaesthetist, and we'll do her operation probably on Wednesday.
Now, the cough that she's had, does she still have the cough?
My name's Chris Smith. I'm an anaesthetist. I work at Starship Hospital in Auckland, which is the children's hospital there. I've been coming to the Philippines, well, this is my 5th trip. I've been coming for about 7 years.
We're just going to measure the oxygen, and I'll have a listen to the heart and lungs.
As opposed to back home where most of the children are healthy, here there's a problem with diseases that are endemic, things like tuberculosis. And also some of the children will have problems with their heart, congenital heart disease. The children with active chest infections, for example, or tuberculosis which has not been adequately treated, and we have to say, listen, I'm sorry, but we feel on balance it's safer for us to treat the chest infection. They will get seen by our paediatricians, and we say we're better off doing them next year. The mother would have been disappointed for the child, but the feeling I got was that she understood why we had to make that decision. You know, we've just got to be very careful screening the children so that we don't have problems during the anaesthesia and surgery.
We do get patients that won't be able to have the surgery that they would like, and that's very sad when it happens. But those kids are followed up the next year and re-screened again for the suitability.
We come in here every year, so we can do staged procedures, we can do follow-ups, and children that we reject 1 year, we will be back to do another time.
Do you have any questions?
If we were only here once in a blue moon, we might be tempted to push the envelope and take a chance. We don't do that. We try and do it safely.
Good thing. So we have put the lip, close the lip, and close the palate as well. Yeah, okay?
The child needs a lot of teeth out, and it's just traumatic coming in. There's 85 people sitting out there, 200 people in the waiting room, and it's all a bit overwhelming for her, you know, and maybe a sense of relief that she's finally getting it fixed. The little child's 4 years old and got gross dental decay, probably needs 6, 7 teeth out.
We do see a lot of kids ranging from 6 months old to as old as 30+ years old. It's sad when you see those kids, and especially those adults that could have been treated a long time ago.
He's got what's called a Tessier 0 midline facial cleft. That runs right from the skull through the midline of his face, right down through the palate. You notice that his eyes are pretty wide-spaced, and there is absolutely no nasal bridge structure or any structures in the midline like you or I would have. That needs to all be brought together. Because I'm not going to be doing a craniofacial repair where I'm opening the whole head to do this, I'm going to do a modified repair to make him look better. I don't have the facilities or the ability to do what he needs to have done in the way that I would normally do it in a first world setup with the backup that I would require. Jason, do you understand what we want to do for you? Okay, we're going to try and build a new nose, and we're going to close that palate so you can speak clearly. Now we're going to take some rib from here. Can I have a look at your ribs? I'm estimating at least 4 to 5 hours for the surgery I'm planning for him, because I have to harvest rib grafts and shape them and inset them, dissect all the tissues, and I need to repair his palate as well.
We met Joanna in 2009, and at that particular time, it was very frustrating that she's not at all suitable to have surgery due to the fact that she's very malnourished.
It'll take about 3.5 to 4 hours. It's going to be a big operation for her.
She's asking is it dangerous to operate?
There are always some dangers with bleeding and scarring, but the operation itself is not particularly dangerous.
You're balancing things like if we don't operate soon enough, she's going to pick up bad habits and her speech will never be right. But by the same token, we don't want to operate on a child with an untreated medical condition or who is grossly malnourished.
We look forward to seeing her. Okay? Thanks.
Joanna's family situation is that her grandmother does a lot of the caregiving, and she's outstanding. She brings the child to the clinics, and we can rely on her to be doing the follow-up, so we'll see her again next year, and I'm quite sure Gran will be making sure that she gets along to her speech therapy.
Wow! Saan mo natutunan yon? Where did you learn that? Because she's already 4 years old, we need to correct.
We then need to teach them to unlearn all the bad habits they've had in producing speech with an unrepaired palate. They have to learn, like learning to ride a bicycle. You can do as much as you can do, and it's still just a drop in the ocean. But if you can keep it in perspective, that this isn't about the numbers, it's about the individuals that you're treating. Whether we come up here and change the life of one child, 10 children, or 70 to 100 children, doesn't really matter. You can't save everyone, but the ones that come across your path, you can make an honest effort and save them. They don't have a lot going for them, But they are happy, cheerful people and very grateful for anything that is done.
Oo, minsan pag lumalabas siya, muuwi o umiiyak. Inaandaw siya ng mga bata, tinutokso. Gusto niya makipaglaro, kaso pag uwi, umiiyak siya. Oo, minsan pag lumalabas siya, muuwi o umiiyak. Inaandaw siya ng mga bata, tinutokso. Gusto niya makipaglaro, kaso pag uwi, umiiyak siya.
I grew up in the Philippines and I've been very fortunate to live in a paradise which I called New Zealand. I'm very fortunate I wasn't born in that very underprivileged community. But I've seen the effect of poverty on those underprivileged families. So at the very young age of my life, I knew from my heart that I'll be able to give something back. I'll do it.
The usual sort of slightly chaotic start to the week. You know, all standard.
We have to get rid of all of these rotten teeth before we can actually do the surgery. So often we'll put them to sleep on the table, ready to do a palate repair, and we'll ask the dentist to step in and just clear out all those teeth.
It's pretty much like the school dental nurse when I was a kid at the moment. The sterilisation is basic, but they're doing the best they can. There's quite a lot of need for removal of teeth and tidying up their oral hygiene to speed their recovery and also to bring them back to function so that they can eat and not be malnourished.
How are we doing?
Dental all done.
Excellent. We'll put the throat back in and then we'll get on with the plastic bits.
Basically, this is a public hospital. They do a lot of obstetrics and they do some general surgery. But for the week that we are here, in effect, they sign over the infrastructure to our use. We have a ward upstairs which is dedicated to our use for our post-op patients. We have 4 operating theatres that we can use. There's 1 extra operating theatre which is kept by the hospital for emergencies. So if somebody comes in with a gunshot or an emergency caesarean section, that theatre would be used. We bring in the equipment, all of the anaesthetic machines we supply, and we go from there.
My name is Craig Birch, and I'm an anaesthetist living in Auckland. I work primarily at Middlemore Hospital in South Auckland. When they stick the thing under the shoulder. The anaesthetic machines that we've brought over are very old and outdated, and we use some drugs which we wouldn't use in Auckland because that's all we can get here. But we basically just make sure that what we're doing is absolutely safe, and we don't compromise on that at all, and we just stick to doing basic things really well. This is Ella. She's 18 months old, but she's tiny. She's obviously quite malnourished. She only weighs 6 kilograms, which is sort of the age of a 5-monther in our world. She was asleep in her mother's arms, so we just put some anaesthetic gas over her nose and mouth. She didn't wake up at all when she came into theatre, so she won't remember any of this at all. And Tristan will be starting the surgery soon.
Oh, look at that. I thought I saw the technician in here last night. One of the things that often amuses me is the preconceptions that people have about what plastic surgery is and does. Plastic surgeons operate from the top of the head to the bottom of the feet, plus a lot of the internal organs. We will take out pieces of gut to use as a free flap in reconstructing a neck. We will operate on patients from birth right through to septuagenarians, old age, skin cancers. Cosmetic surgery, which is appearance improvement, is really a very small component, maybe 10% of what a plastic surgeon does. Thanks, Greg. Thanks, Ian. Josie, Adam, thanks very much. The other question I'm often asked is, where does the plastic come from? Does it relate to something that we use? Well, it derives from the Greek word plasein, which means to mold or to shape.
because in plastic surgery we regard it as the high point of what we do is moulding and shaping tissues to either replace something that's been lost or damaged or that was never there, as in a cleft lip or a congenital anomaly.
I just assisted with my first ever theatre case. This tiny baby and just the feeling that it's done, it's fixed, and I was part of it.
That's the way.
Someone said, go and get a cup of coffee. I said, I don't need coffee. I've got a buzz.
I can go back to sleep.
I think that's the natural sleep, isn't it?
Oh my God!
Wala po, umalis po. Umalis. Sinundan daw po kayo doon sa ospital.
Umalis yung asawa mo?
Yung mister ko po may trabaho kahit pa paano. Kaya nasusuportan namin siya kahit kaunti.
As a parent, you have high hopes and dreams for your child, that one day they'll be very successful. That's every parent's dream. He's been waiting for surgery to happen ever since he was small, but due to the lack of funds and financial support, it's at this stage that he's already 20 years old that he's going to be able to have this surgery. Huh?
Electrician.
Electrician, all right. He had completed his high school, so he's ready to go to university anytime. He wanted to be an electrician. And the reason why he's not going to do his university studies for this technical job training is very shy and very ashamed to go and mingle with the rest of the other students who's got normal face.
We're about to start day 3 and everything's going along according to plan. Pretty much situation normal. The biggest drawback for me in this particular trip is the fact that we have to travel an hour each way in traffic, which would make your hair stand on end.
The population in Manila is about 16.3 million.
It doesn't matter what time of the day or night it is, there are people on the streets, there are cars on the roads, it just doesn't stop. Two years ago, Joanna presented to our screening clinic and it was felt that she was malnourished. Looking at her now, she is much better fed, but she's still very small for her age, but we think that she's a safe candidate for surgery. I understand that today her mum's been able to come along with Gran, so she's got lots of family support for today's surgery.
Finally, the day has arrived for her to have surgery. And this totally will change her life.
Have Mum hold both her hands. Oh, it's cannibal.
On the aesthetic side of things, she's a pretty healthy little girl, although she's very small and undernourished. But because her chest and her heart is fine at the moment, she shouldn't pose any sort of extra or special risk from the aesthetic point of view. So she's getting sleepy now. Okay. And we'll pop her head down in a a second, just a few more breaths. She was a little bit unhappy to go off to sleep because of being nervous and so on, which is not uncommon.
Salamat.
I've given her a whole lot of pain relief through her IV here, so she won't feel the surgery. And Tristan will put some local anesthetic in, which will also mean that she's comfortable when the surgery starts.
She has what we call a double cleft or a bilateral cleft lip and palate. This is the lateral gum line on the left, this is the lateral on the right, and this premaxillary segment should fit in between those two like the keystone in an arch. But unfortunately, because it's cleft and it's not attached to either of these and there's no muscle across the front to restrict its growth, as happens in the normal, this grows forward dramatically. And you see there's a huge gap or separation between the premaxilla and the lateral segment. And that makes our job much more difficult. In a country where there is a program set up to deal with these kids, from the moment of birth, there will be a little plate fitted to prevent just this happening. As it is, it's going to be a bit of a challenge to get that tissue all the way up and to restrain that. But once we've got the muscle repaired, it'll restrain that growth so that these lateral segments can grow up and join on properly. And we'll do that final stage in a year or two's time. So, we're about to get started. Because she's already 4 years of age, I want to repair everything from the back through to the front. I want to start at the back of her palate, repair the whole palate, and then get onto the lip and repair that. And as part of my lip repair, I'll do something of a lift of the tip of her nose and narrow the base. I would estimate that that whole piece of surgery will take about 2.5 to 3 hours. This is the oral layer in here. This is the mucosal layer down there. That's the base of the nose. We're going to fold that over to join that. Part of our role here, we believe, is to teach a man to fish rather than catch all the fish for them. So as much as possible, we try to teach the locals.
Remember why we do that?
The big stumbling block is that there isn't the funding available for them to carry on and do their own cases. Because at the end of the day, if a patient can't pay for their surgery, they're not going to get it. It's fairly meticulous, careful stitching. We're working with tissue that's a bit like wet toilet paper. So you have to be very gentle with it, but at the same time, you have to stretch it across a gap which it hasn't closed before.
We had this light working on the first morning, which is the main theatre light, but unfortunately it blew, so we've had to change and use this light, which is not brilliant. Fortunately, Tristan has his own headlamp.
My name is Indu Kapoor. I'm one of the pediatric anaesthetists. I live and work in Wellington. And yeah, this is my first mission here. I need some oxygen flowing, please. Can you make sure the oxygen is flowing?
I think it's just the contact. The contact.
Okay. Some of the equipment is a little bit old, so we need to be cognizant of that. Also, not having trained assistants, it's absolutely essential to make sure that I've prepared everything and have had my emergency plans in place before we start. So I think that's probably the biggest difference. And communication. Language can be a bit of a barrier.
We're trying to close the skin and the lip elements as accurately as I can, because this is what's going to catch the eye. This is what people will see. And this has to be absolutely precise. I'll let you grab it. Thanks. Thank you very much, everyone. That was a great team effort. Well done, you guys. The payoff for us comes when you can hand back to a parent a baby that 2 hours before had an unoperated cleft and now looks like a normal child with a few stitches in the lip. The look in that parent's eyes is worth rubies, and I can't describe it. It makes everything we do worthwhile and then some.
Medyo kagigising lang niya na, kaya minsan nahihilo pa. Minsan hindi niya alam yung nangyayari. Pero pag nadinig niya yung boses mo.
This is, to me, one way of giving back.
Kanayak, bebe. Andito na sila, mama, tsaka si Lola.
I have been fortunate in that I was able to get the education I did. I am fortunate in that I am able to earn reasonably comfortably. And insofar as that pertains, I feel that it's incumbent on me to give back to those who don't have that opportunity.
And that has to be the best feeling in the world. You take a kid who's got an affliction like that, and you do 3 hours of surgery, and that child is transformed. She will get better over the next year, but at the moment it's done, and it's just a wonderful feeling.
I personally believe, first of all, that if you are miserable or depressed, the best way of picking yourself up is to do something good for someone else. And not only does it take the focus away from your own misery, but you actually get an endorphin rush out of doing something good for the other guy. For some people, it's as natural as breathing. For others, it's a real effort to be kind. But I think kindness makes the world go round.
Thank you very much. Thank you.
Bye-bye, gorgeous.
It smooths the way, it eases interpersonal relations, it makes you feel better, and it certainly makes the chap receiving the kindness better. And we're talking kindness with no strings attached. Kindness is essential to what we do. It's part and parcel of what we bring to this.
It's so much emotion when you have these children, see them on the last day, and they are so happy, and the parents are so happy. It's wonderful.
Obviously, not everybody can be physically involved in helping, but you can do fundraising, and the fundraising is a huge help. In a trip like this, for an investment of about 70,000 New Zealand dollars, we can change the lives of 100 children in 5 days. That's not a lot of money.
Thank you very much.
Oh, thank you so much. It's a great pleasure.
They don't have to say a word of gratitude. I know how they feel. And yet, despite that, we have parents who literally do not have 2 beans to rub together will come to us a day or 2 later with some sort of gift, whatever it may be. And it is just heartbreaking sometimes.
That's lovely, eh? Yeah. That's why we come here and do this. Thanks again. My pleasure.
Supporting local content so you can see more of New Zealand on Air.